Hello and welcome to The Virus. I'm Jeremy Fernandez. 3 years into the pandemic, many people are experiencing a state of chronic fatigue known as burnout. But what are the signs and what do we do about it? In fact, more than 7 out of 10 Australians working in the healthcare system have experienced burnout in the first year of the pandemic, according to a survey of almost 10,000 frontline workers. We'll speak to the researchers behind that study in a moment, but first let's hear from the Secretary of the Queensland Nurses and Midwives Union, Kate Veitch. Kate, welcome to the program. What are your members telling you about what's happening on the front line for them?
Thanks, Jeremy. Look, on the front line right now in hospitals and health services across Queensland, there are lots of nurses and midwives experiencing burnout. Burnout is a state of unmanaged stress over a long period of time. The prevalence of burnout in nurses and midwives is higher now than ever, and obviously that's on the back of the COVID-19 pandemic.
We know the COVID pandemic has been an exacerbating factor. Do you have a sense of how much worse it's gotten because of that? How bad were things before COVID?
Look, here in Queensland, we were able to undertake a survey of members prior to last year's Omicron outbreak in December. And what we know from that was there was about 58% of people surveyed, our members surveyed, who said that they didn't feel safe in their structures right there and then. They didn't feel the system was safe for them or their patients. We do know that burnout has been happening across the world in nursing and midwifery for many years prior to the pandemic.
Can you explain that a bit more for us? What do you mean by the structures weren't safe for them?
Yeah, so what we do is we regularly obviously have communications with our members, and there are 3 top issues that have come up again and again prior to the COVID pandemic, but much more during the COVID pandemic, which are workloads, the stress of actually managing the high demand in the system pre-COVID, but also safety. So safety in the terms of their psychological, their physical, and their cultural safety. And the last thing that has been stressing nurses and midwives here in Queensland and across the nation has been job security, especially in the aged care sector.
Do you have a sense of how far these problems penetrate through the healthcare system?
Look, in terms of nursing and midwifery, we are the largest clinical workforce, and that's everywhere around Australia. So we would think that these problems are penetrating all of the health services, the community services, and obviously aged care services where nurses and midwives work.
I'm interested in what that means for the quality of work and the safety of patients as a result of that burnout.
Yeah. Well, what we know is that a system that doesn't have a positive practice environment, and what I mean by a positive practice environment is one that embraces a safety culture, one that provides safe workloads for nurses and midwives, good communication and collaborative practice, safety on all levels that I mentioned before, which are physical, psychological and cultural. These are indicators that when the environment isn't giving those aspects, that the situation for nurses and midwives is that they can't provide the care that patients need. So that does compromise the safety of both the system and the patients and the nurses.
What does that mean for the patient? Does that mean prolonged treatment? Does it mean a greater risk of death?
Look, in terms of what happens is the nurses and midwives work harder. They work longer. They're in a system right now where the numbers and the amount of overtime that nurses and midwives are doing to keep the system safe are enormous, Jeremy. I can't go into the numbers, sheer numbers of hours that nurses and midwives are working extra to maintain safety in the system.
We're obviously in the middle of the flu season now. How do you see this playing out over the next few months, in these critical few months where COVID intersects with cold and flu?
Look, we've been referring to this situation as fluvid in our general membership. It is a real concern because we are on the back of 2.5 years now where the system has been under enormous strain with COVID. And to have a combination where we're seeing COVID cases and flu cases, very serious virus infections in our general community demographic, it's causing us to have increased demand in the system. So this is placing an enormous strain on an already very fragile health system.
Kate Veitch, great to have you on the program. Thank you.
Thanks, Jeremy.
Let's talk to two people now who've examined burnout and how it impacts health workers and patients. Karen Willis is Professor of Public Health at Victoria University and Natasha Smallwood is a Professor of Public Health at Monash University. She's also a respiratory physician at Melbourne's Alfred Hospital. Welcome to both of you.
Thank you.
Thank you.
Natasha, tell us about your survey. This was done in 2020. It followed 9,000 healthcare workers. What were the findings?
So we surveyed actually just under 10,000 participants from across Australia. So we got a really incredibly high response rate of healthcare workers around the country. And what we identified was that about 70% of people reported having burnout, 60% had symptoms of anxiety, a similar number had symptoms of depression, and about 40% reported symptoms of post-traumatic stress disorder, which is really actually quite an astonishingly high level of mental health symptoms. The other thing that we found that was really interesting in the study was that many of those healthcare workers recognised at the time that they had those symptoms. So they actually had very good insight into what they were experiencing. And yet, again, rather astonishingly, what we found was that only 25% of people actually sought any professional help to deal with those mental health symptoms.
And was this survey motivated by the outbreak of COVID? What was the reason you started this study?
Absolutely. It was motivated by the commencement of the pandemic. And I guess really the impetus was my own experience as a frontline healthcare worker, seeing the chaos and disruption that the pandemic very quickly generated in our healthcare system. You know, in February 2020, when we were seeing the high volumes of patients who were really unwell overseas and the really high numbers of admissions and, you know, really strong healthcare systems overseas being overwhelmed, it created a lot of fear in our own healthcare system and led to quite a lot of chaos and disruption. And seeing that around me made it quite clear that all of us were experiencing these symptoms, and that if we did not systematically measure this and report it, it would be difficult to argue for change down the track, as we very much are arguing for that change right now.
Karen, were there any particular accounts from the front line that stood out to you?
Well, certainly we asked, in addition to the quantitative measures in the survey, we asked frontline healthcare workers to tell us about their experiences by asking free text questions. And certainly what comes out are in-depth stories of people's fear at the time, the worry they had about being able to provide good patient care, the concerns they had for spreading the virus to their families, and the need really for organisational change and the culture within healthcare systems.
Talk me through that kind of concern about patient care. What is it that they were worried about?
Well, at the time, you may recall that at the time, one of the biggest impacts that was felt for patient care and across the community were around visitor restrictions. And so healthcare workers talked about having to comfort people who were unable to have their family close by, to witness people dying without their loved ones present. And this caused huge, what we call moral distress for healthcare workers. But they also talked about the struggles to provide good patient care when they were needing to, for example, don and doff PPE, and the increased time that took in terms of the provision of patient care. They were also extremely worried about people not seeking help, or not being able to provide help because of the fear of the hospitals being overrun. So it was kind of traversed a whole range of issues that they saw that patient care may be compromised.
Professor Natasha Smallwood, this survey was done in 2020. For you as a frontline health worker, do you have a sense of how things have changed since then?
I mean, things have changed to an extent in the sense that we now have, we have good levels of personal protective equipment, we have vaccines, we have treatments, and I guess we have the experience in this country, which is very unique, of having a healthcare system that has never been completely overwhelmed. So we are very privileged, and 2 years down the track, it's quite reassuring where we are. But I guess what we're experiencing is a really high level of burnout, because healthcare workers have had to continuously respond at this heightened level of stress for more than 2 years now. And, we've got people who are working excessive hours. And on top of that, we've got all the catch-up care that we're doing. So we know a lot of people did not come forward for, routine appointments. We didn't see the usual numbers of cancers or heart attacks or other medical conditions that we normally would have seen in 2020 and 2021. So there's a lot of catch-up work that is now coming to us. And while the virus levels have settled a bit, we're now going into our influenza season, and we have really high numbers of patients in hospital with both COVID and with influenza. So it's really challenging because the pressure doesn't stop. And that's why so many people are burnt out, and we're hearing increasing numbers of people who are leaving because of that pressure.
Professor Karen Willis, there's often an emphasis put on people trying to cope with COVID on finding some individual resilience. To what extent does that help a frontline worker?
Well, we actually found that healthcare workers are extraordinarily resilient. We did a measure of resilience in the survey, and they scored really highly on that. What we do find that sometimes supporting individuals and providing individuals with those kinds of interventions may be useful, but more importantly, what came out time and time again is the need for organisational and cultural change to actually really support the mental health of health workers at all times and not just in crises. So one of the papers that we wrote was called Cracks in the System, and the idea is that what COVID did was really amplify the cracks that were already existing in the system in terms of really providing good organisational support for healthcare workers.
Professor Smallwood, we often hear about the need for more training, the need for more healthcare staff in regional areas, more urgent care clinics. This was part of Labor's election platform. These are fairly long-term propositions. What's the immediate fix while those other solutions come online?
Sadly, I don't think there is an immediate fix. I think actually the most cost-effective and common sense approach is to take a long-term vision to this, that we do certainly need more support, particularly in the regions. And in fact, we studied the regions as a subgroup in the study, and it was very clear that they had exactly the same issues, even though they didn't have as many COVID cases. There's always going to be another crisis around the corner, and we need much better long-term preparedness for crises within hospitals and within primary care. And that involves investment, considerable investment. Yes, we need more healthcare staff. We cannot be dependent on having our health workforce coming from overseas. So we need to train more of our healthcare workers. But we need the system to improve so that those healthcare workers don't leave when, crises happen, and we cannot afford to lose an expensive, precious resource when there is a crisis and people become burnt out.
Professor Natasha Smallwood, Professor Karen Willis, thank you both for your time.
Thank you.
Thank you.
In South Australia, a new clinic for long COVID sufferers has just been opened. It's received dozens of referrals since it opened last month. Current data shows that between 2% and 40% of people who contract COVID-19 end up with long-lasting symptoms, some for up to 2 years. Isabel Damon filed this report from Adelaide.
Those with long COVID often experience symptoms like a persistent cough, severe fatigue and muscle pain and weakness for weeks or even months after contracting the virus. Those patients here in Adelaide are now being referred to a long COVID clinic at the Royal Adelaide Hospital. It's brought together medical professionals like physiotherapists, cardiologists, lung specialists and even psychologists to try to provide more effective, organised and well-rounded treatment.
Patients, when they come to the clinic, are very appreciative of the information they are given. Primarily what we give them is reassurance that the symptoms that they're experiencing are real. That's usually the first question we get asked. Is this just in my head, or is this really due to COVID?
I've aged probably 10 years in the last 2 years. I'm what I was to what I am now in physical ability is considerably different.
I'm relieved that there's help out there, and they're very thorough, absolutely thorough, compassionate. I feel compassion from them, and I can see, that they're learning from us as much as we're learning from them.
The information collected through the clinic is being fed back through to researchers trying to get a better idea of the full impact of long COVID. Specialists believe it could still be years before the condition is fully understood. They say while treatments are still being researched and confirmed, the best defence against long and severe illness is vaccination.
And that is the show for this week. Thanks for your company. From all of us, bye for now.